Today we are to represent the next segment of Unit 4, that is drugs used for erectile dysfunction, that is ED. Short form of erectile dysfunction is ED. Here in this topic we have to discuss related problem of erectile dysfunctionings along with their line of treatment, some drugs which are used for the erectile dysfunction like conditions. So now we have to continue with these sessions, erectile dysfunctions, the drugs which is used for these conditions. So the introductory part related to the erectile dysfunctioning, as per the National Institute of Health, the erectile dysfunction defined as the inability to attain or maintain an erection sufficient for satisfactory sexual performance. There is a no ideal first line diagnosis stage for ED, and routine screening is also not suggested for erectile dysfunctionings. Mostly the patient history, physical examinations are enough for diagnosing erectile dysfunctions. The erectile dysfunction is caused due to the some different causes. There are some causes here represent the organic causes like example vascular, neurogenic problems, hormonal changes, anatomic and drug induced causes. Due to that, there is a maybe chances of erectile dysfunction. Some other factors like psychological causes or sometimes both also involved to produce erectile dysfunction into a particular human beings. In sexual erectile, response is caused by the interaction between neurotransmitters, biochemical process, and vascular smooth muscle response stimulated by parasympathetic and sympathetic neural triggers that integrate physiological stimuli of the penis with sexual sensitivity and desire. This is a sexual erectile response. If any impairment in this response, erectile response, that impairment is called as erectile dysfunctions. Nitrous oxide produced from the endothelial cells after parasympathetic stimuli triggers a molecule cascade which cause smooth muscle relaxations and arterial influx of blood into the corpus cavernous. This causes compression of the venous return that result in erections. So, in that case, the drugs which are used for this erectile dysfunctionings, they mostly working on the PDE inhibitors, that is phosphodiesterase type 5 inhibitors. Most of the drugs which is used in the treatment for erectile dysfunctionings, they work on this inhibition of enzyme phosphodiesterase type 5. It is considered as a first line therapy in erectile dysfunctioning conditions. For this erectile dysfunctioning conditions, the drugs which is used apart from these PDS inhibitors, the most effective drug in this category, that is Cedenophil. Cedenophil is an effective and safe drug for erectile dysfunction related to diabetes mellitus and spinal cord injury, and in male with sexual dysfunctions secondary to antidepressant therapy, this drug Cedenophil was used. About one third of the men having erectile dysfunction does not respond to the PDE inhibitors. So, as per the phosphodiesterase type 5 inhibitors for erectile dysfunctions, these are the drugs in this table. You have to see the drugs which are used in the erectile dysfunctionings along with the dosage forms And the recommendation time between dosing and sexual intercourse, and the onset of actions and duration of action of that particular drugs. The first drug which is used as a phosphodiesterase type 5 inhibitors, which is used for the erectile dysfunction, that is Cedenophil. The common brand name containing these drugs, that is Viagra. The dose, usual standard dose of Cedenophil is 50 to 100 mg, and the recommended time between dosing and sexual intercourse is 1 hour, and the onset of action of this drug is 15 minutes to 16 minutes, and the duration, total duration of these drugs exerting the action is up to 4 hours. Second drugs from this category, that is Adenophil. The brand name related with this drug is Celis. The usual dose is 10 to 20 mg. Onset of action is 12 hours, 1 to 12 hours, and onset of action 16 to 45 minutes up to 36 hours. The duration of action was carried out in human beings. Another drug is Vardenafils, 10 to 20 mg standard dose, which is given or prescribed for Vardenafils. 1 hour recommendations, gap between dosing and intercourse, and total onset of action is 25 minutes and duration is 4 hours. In this category, the maximum recommended dose per 24-hour is the maximum strength dose for each drugs, and plus this sign indication on durations. This indication in which the successful erection may be achieved after a dose. These are the some drugs which is used in erectile dysfunctions. The above mentioned tables, the drugs which is PDE inhibitors, they have relatively same efficacy. However, their dosing, onset of actions, duration of therapeutic effect are different one. If you see in the tables, in these tables, the onset of action and duration are different in all the drugs, along with the dosing. In this PD5 inhibitors are well tolerated. These PDE5 inhibitors are well tolerated and produce mild adverse effect like headache, flushing, dyspepsia, rhinitis, like conditions. Small adverse effect or side effect related with this P5 inhibitors. And most of the drugs generally used for erectile dysfunctioning is Cedenophils and Terranophils. First of all, we have to discuss with the Cedenophil, which is act as a phosphodiesterase 5 inhibitors. This Cedenophil is a vasoactive agent. It is generally used for the treating of erectile dysfunctionings, also reducing the symptoms of pulmonary arterial hypertension. In that conditions, this Cedenophil also used. This is the structure of Cedenophils. It having pyrimidines and purine. That is purine base present in the structures, and there is substitution of this sulfonine containing moiety substituted in the Cedenophil structures. This Cedenophil is used as a phosphodiesterase 5 inhibitors and mainly used in the erectile dysfunction and pulmonary hypertension like conditions. Cedenophil is used. Second drug is Terranophile. The second category of PDE5 inhibitors. This drug is orally administered and it is used for the treating for erectile dysfunctions. The structure difference between Cedenophils and Terranophils. In Cedenophils, the purine is the basic moiety present, whereas in Terranophil, this is a pyrimidine moiety present along with benzopyrrole moiety as a heterocyclic moiety present in the structures. This is the structure of Terranophils, and this Terranophil is used for the treating of erectile dysfunctionings. It also raises the blood flow to the penis and thus resulting in sexual stimulation with these drugs to overcome the erectile dysfunction. It is also used for the treating sign and symptoms of beginning prostatic hyperplasia, that is BPH. This drug is useful. As per your syllabus is concerned, the Cedenophil and Tadanophils, these two drugs which is mentioned in the category drug used for the erectile dysfunctions.